Okay.
Or I can, but I figure you're better
I,
suited for that
yeah,
job.
I'd be happy to let you, but I'll just go ahead and just go down the agenda. So the mental health board treasurer's report, we're opening the meeting, and Peterson is listening and present by phone, but he is unable to talk. So I'm going to run the meeting. The mental health board treasurer's report, we have $1,909.91. There is one vacancy in District 2, but Marianne, does that include you, Marianne? Is that?
Well, there was a
Yes.
lot of
Yes,
there was a
because
lot
there was
of arm twisting from my neighbor, Mr. Rabbit's aide, and my husband, saying I really need to stay on the board. So
Okay.
here I am.
there were 2 vacancies. So now so now it's 1.
Okay, so welcome back, Marianne, officially.
Thank you.
Yeah.
I think.
Okay, and there is one vacancy in District 5. And I understand there's an applicant for that vacancy. However, I am willing to step aside if they fill that +1, find another person.
So can I speak to that, Kathy?
Yes.
So I'm glad you brought this up because I have moved back to District 5. And so I am wondering about the logistics of that as far as if I transfer, if I need to reapply, how that works.
I think I would, so you were in Rabbit in
Correct.
Tuesday, and now you're in Hopkins. So I would, I think I would talk to either one of them or both of them.
Okay.
Because I think they will make the transfer.
Okay.
So
that means I would
that means I may just be participating as a once that happens, and if we get another person, I may just be participating as a an attendee.
Mm-hmm.
So
And the other person said March. The last we heard was March from Nicole.
Okay, so that's coming up then. So go ahead and talk to Linda Hopkins or Supervisor Rabbit and
thank you.
how that works.
And I will mention because Linda will likely say we're full, but I'll let her know. Unless did you already let her know that you were willing to step aside?
I have, and her aide Tracy was online.
Okay.
During the last meeting when I said that I was willing to step aside.
Okay. All right, cool. So I'm planning to be at that the town hall, the District 5 town hall on Saturday as well. So maybe I'll talk to her there as well.
Okay, and I will let her know. I'll reaffirm that.
Cool. Great. Thank you so much.
Okay. So if you haven't taken the ethics training, you need to do that, and you are going to be sending out an email to that effect.
I'll be doing that today, actually. Yes.
Okay.
Yep. There's not that many. There's a few.
Yeah. And I don't see a representative from Supervisor Gorin's office. That it said that
right. That's right.
3 to 5 minute.
Yeah, that's right. And I did confirm back that was fine.
So I don't see anybody here representing her. So if they pop on, let us know and we'll move to that.
Okay.
Okay, so last, we did talk about special topic, and I am realizing I wasn't clear on who was contacting the people for this month. It was the new director for youth services for the county, and the psychiatrist who was focused on foster youth. So does anybody know who that was supposed to contact them? And I'm including the possibility that it was me, but I don't remember.
I believe that you had said that you were gonna do contact for the psychiatrist since you were in that QIC meeting where they had presented.
Okay.
And I just found my notes from the last exec committee.
I think it wasn't that 2 meetings ago, because Tori gave me that info and I never heard that. Dr. Broadbent, is that who you're talking about?
Donna Broadbent?
Yeah, Donna.
I'm not sure of the name.
Okay.
She's
Donna,
a
yeah,
Donna.
okay.
Is that it?
Donna Broadbent.
Yeah. So, yeah, I don't know. I don't think that was the last meeting. I think it was the one before that when it was determined. I think we had planned ahead. I could be wrong.
Well, it was the executive meeting on the 4th. I'm
It
looking at my notes
was
from
on
I'm
January
looking at
4th.
January
so
4th.
that
Yeah,
would've
and then we
been-
had the general meeting in between, so it was
Okay.
technically 2 meetings ago.
Okay, so if I can get her email address or other contact, I will do that and see if she can come. She did do a presentation at QIC that I do have a copy of, but I'll figure that out. I'll go ahead and make that contact. I'm going to stand up and get a piece of paper and write down what I'm supposed to be doing.
In addition to chairing the meeting.
Okay.
So actually I see that it looks like Donna Broadbent is, so she is the, I'm looking at the county's website, the division director for family, youth and children. Was that the same?
No,
Okay, so these are 2 different people.
she was the other presenter, I think.
Okay. Yeah. So I think actually I think it was my task to contact her. And then you were going to contact the psychiatrist. And I don't know that we ever had a name on that person.
I can find that name.
Right.
because
That's what I think
she
was.
did present at QIC.
Yeah.
So if I very much appreciate that you would be willing to contact Donna.
Yeah, and I think I do have that on my list of tasks to contact her. So
And
I will do that.
I will contact the psychiatrist.
Cool.
Can I ask, I don't see a family, youth and children special presentation representative on the agenda. That's not the same as TLC representative, is it?
No, that was for the
Yeah.
following meeting.
The
Yeah.
TLC is March.
Yeah, March is TLC, CPI, and SAY. Those are the folks that we're going to reach out to.
Okay, so there's a family, youth and children person, and did you say you did or don't know their name? That's for February.
That's Donna Broadbent.
That is her.
Yeah, and then the psychiatrist we don't have a name for yet, but
Shelby? Is that the Shelby?
No, that's
No,
TLC.
that's TLC.
Okay. Oh yeah.
Yeah.
It's
Yeah,
this transition is hard.
Well, and we made it especially hard in that last meeting because we changed topics and presenters about 3 times for February in the course of our
I know,
conversation.
but Tori
so
and I compared notes, and this is
this
what we
is
came
what my
up
notes
with.
look like. So, well, you can't. But yeah, it's yeah, it looks like I was
Okay.
doing calculus.
So Donna is going to be youth and family, and Michael's going to contact her,
Mhm.
and then Shelby is TLC rep, and then we still have Melissa or Fabi for MHSA update. that
Yes,
correct?
but
That's correct.
Shelby won't be till March.
Okay.
Yeah.
All right.
So the MHSA update
March.
is February?
Yes.
Yes.
Phew,
Okay.
okay, good. All right, thanks.
Okay, so as if they can come, hopefully, then we've got it. We know what we want. I
Mhm.
don't know if it's gonna happen, but we know what we want. Okay, okay, so we know February and March, and then April is North County. So we've got February, March, and April. And so just to be sure, TLC, SAY, and CPI, do
Mhm.
we have? Michael, did you say you were gonna contact
Yes, I will be contacting those folks.
those, all of them? Okay,
Yeah.
thank you, Michael.
Yeah, I already had a commitment from Shelby to come and present, and I haven't spoken with anyone at the others yet.
Okay, thank you for doing that.
Yeah, for sure.
Hello.
Hey, Peterson.
Yay!
Excellent.
Um,
Yeah, Peterson, I had given you permission to talk quite a while ago. So I'm glad that's working.
I don't know, but I've been at the meeting since before. At the
I knew we saw
start,
your
and
number. it just wasn't working to connect you.
Okay, Peterson, I think you're now in charge.
I don't think I'm in the frame of mind to be in charge right now.
Okay, then,
I've been struggling with that for 45 minutes to get into the meeting. I do not have a personal Zoom account.
Mhm.
I only
Yeah.
do the link, and I have been going in circles trying to get this, and I'm pretty flustered, even if I'm sitting at my desk at my office right now.
okay, I'll continue today and
Uh,
figure it out.
I
this
don't know.
month.
I need to get something better than that, because otherwise I can't come to meetings.
Yeah, that's,
Because if the next meeting it will be the same thing, and I will
Well,
not spend 45 minutes trying to
What have
get into
you,
the meeting.
how have you come on in the past?
Just do the link and I just go right in. But that's for the first time for the past, since we have been doing Zoom, I cannot get in. It asks me to go into an account. I don't have an account, and I don't wish to have an account because I use my Zoom from work. I tried my work one, it still asks me for the same account, which I don't have.
Yeah. So
Okay,
there's
yeah,
just something about
you
this one
shouldn't
that
have
is
to
just-
have one. I will check in on that too. I'm sorry about that. If it's something I did differently than Tori and setting it up, maybe I'll
I
find
don't
out.
know, but
I will
really
find out.
frustrating.
okay.
Okay,
So,
but I have been hearing what is going on. I just couldn't speak. I just couldn't participate. I couldn't even see here. I'm here. But
yeah. Okay, so we'll go ahead. Board planning and special topic presentation. And then we also have, so that's pretty much taken care of. The behavioral health director's report, and Jan is not here yet either.
She just asked, this is the third time for a link, and I'm just hoping she can get on now because I've sent it to her a few times. Gosh, I have no idea why this is difficult or what's different about it, but I will try to find out.
I see
Yeah,
Jan
there are a lot of settings on the
as Jan
you
is
set
here
it
as an attendee.
Oh, great. Let me get her over here. There she is. Yeah. Okay. Hang on. Okay. Promote to panelist.
Okay, I'll be right back.
Okay, perfect. So Jan's over as panelist. Yay. Excellent. Excellent.
All right. Okay. Good morning, everybody. Good to see you.
Hey,
Good
Jen.
morning.
So we are right where we would be asking for you to give a report.
Okay.
So welcome and take it on. Take it over.
Well, we're very busy working to prepare for the external quality review that's coming next week. So I think that we've had good response for people interested in participating in our focus group. So I feel good that we have good stakeholder participation through the process. So, and when we've been reviewing the agenda, last year was a really busy year for our system. So we opened the PUF. So we opened the Crestwood Psychiatric Health Facility. We worked on expanding the mobile support teams and we started in response. I came on board. Okay. So the other thing is, as a system with, beginning to implement the CalAIM, all the CalAIM requirements, we've been busy doing that. And as I've been telling you, last time I saw you all, we're dealing with all the complications of planning to implement a new electronic health record. So currently we use Avatar and SWITS. We have joined with 20 other counties to implement an electronic health record called Streamline, made by SmartGate. And it's been specifically, designed to help incorporate all of those CalAIM, all the new Medi-Cal CalAIM requirements. So it does a lot of the thinking for us already, but we still implementing an electronic health record is a big thing. So we have a steering committee, we're working on it, and we've identified a project manager, an internal person who stepped up. I think you all know Wendy Wheelwright. So she's amazing. And she's going to do interim, okay? Because we really want her overseeing the adult services that she does so well. So, but she stepped up to that. And so anyway, so that's some of what we're working on. And then always back to staff recruitment and retention. We still have low staff vacancy numbers. I'm always marveling every time the numbers come out, because I sign so many offer letters. That's one of my jobs, to sign these conditional offers. I'm like, oh, this is exciting. Look at all these people I'm signing letters for. And then it just stays at that 25-26% vacancy rate, because we have people also who are retiring, leaving, going to work for other counties, and so on. So, but what's remarkable to me, and I'll just share, this is my feeling, is that in spite of the low vacancy rate, I am continually inspired by the work that our teams do. They just have an incredible group of staff that are doing remarkable work and keeping our programs running. So that feels good. At the same time, we really do need to, I know that the union is in negotiations with county leadership around increasing salaries and things like that. Because we really are in competition with other counties that might offer higher salaries, and we've lost, we've lost some people to other counties because they're offering more money, So, and I also, at the state level, Cal Mesa, make sure where are my notes? Cal Mesa is, they're always coming up with great ideas, and they are, they're spearheading the peer certification process. So we're continuing to move forward with that. And we, on our MHSA plan for 23-26, we are really have proposed that we add, all these peer positions to our county programs because we need them. We have a great network with, say, West County Community Services, the peer supports that they offer. Buckaloo also has excellent peer services out in the community. We also need to infuse our programs with that same peer expertise. Also, I feel like by bringing peers into our programs here, that also will address some of those shortfalls of, like, when you're short on therapists, you have peers, you have staff who can provide support to our clients, So they really fill an important gap there. So anyway, so peer certification's coming along. Cal Mesa has been spearheading that. And then the other thing that they're talking to us about is they issued an RFP to universities looking for some schools that would be interested in doing some kind of workforce partnership. And they are entering into an agreement with Palo Alto University that Palo Alto University would start off with a cohort of 50 students, 25 of them from rural counties, because we have, believe it or not, Sonoma County is considered a middle-sized county, and I think we're a hybrid. I think we're part rural, part urban. We have issues that the rural counties struggle with, as well as the urban. So we're kind of in the middle. But some of our rural county brothers and sisters are really hurting with staff vacancies. I mean, they really are struggling. So anyway, so this workforce partnership opportunity would there'd be a rural cohort of 25 slots from rural counties, and then another cohort for Spanish speaking students, 25. Anyway, so I've already reached out to them. I want marketing materials. They haven't sent me anything, but it's not a completely, they've entered into the agreement with Palo Alto. So the next phase is identifying which counties are going to send students, how they would participate, and so on. But someone would get a master's in counseling degree from this program. And then MHSA would pay, our MHSA would pay for that person to go to school at Palo Alto University. And then we would get, this person would also have to agree to stay with the county for 7 years. So I saw your expression, Mary. But look, I know I was talking about this yesterday with someone, and you're 2 years in school, then you do 2 years postgraduate to get your hours for your license. So then you're really like, you'd give us 3 years of service, right? So 7 years sounds like a long time, but you'd get your education paid for. So I have $95,000 and you wouldn't have any student loans. So that's kind of a good deal. So anyway, so this is like a small project I'm excited about it because I think it could create a template for maybe for other kinds of projects like this, so that we invest in our staff and we provide them opportunities to have education. So, so that's kind of an up and coming thing, which I thought was very positive.
So Jan, can I just make a comment on that?
Yeah.
So Marianne has been working, and I don't know if she still is, with Sonoma State, trying to get them to develop a program. So you might want to talk to her.
That would be great. I know that we have had relationships with local schools to do some of that. And Marianne, I'd love to talk to you more about it. You know, we have our new Ethnic Services Inclusion and Training Coordinator, Lisa Nozal, and she's going to be kind of looking at the groups of the relationships that we do have with the schools. What are we doing? What can we do? I think the Sonoma State for a while stopped taking students during the pandemic. Is that correct, Marianne?
Sonoma State may have stopped taking students, but the students that they had were in their MFT program. And it's very unpolitical for me to say this in a public meeting, but I have learned from others that the MFT school at Sonoma State does not want a school of social work. They see it as competition. And really, it would be a beautiful collaboration. When I was still employed at the Human Services Department, I was working with our director at the time, Yolanda Rinaldo, who was very interested in getting a school of social work at Sonoma State because it was so hard to get MSWs hired for some of our child welfare programs and adult and aging programs. And we started a distance ed program. And so people did the work online and met monthly in person for a month face-to-face meeting. The small counties, the small rural counties to the north of us were very excited about the effort to get a school.
Yeah.
Because a lot of people would have to go up to Eureka, or if they couldn't do it online, or go, you know, the commutes into the Bay Area to the Bay Area schools are, as I'm sure you know, horrific.
Yeah.
And it just seemed like it would be a good addition. Our local MSW program, our local membership group, a woman who has her PhD in social work, or DSW, knew a student or had a student who was working on helping getting schools up and running. And I have not heard she was going to reach out to him, but I have not heard anything back at all. I've asked several times. There's been no update. And it could be because of the COVID phenomenon and schools closing down for a while. But it seems like that shouldn't stop a work behind the scenes. So I'll push again and see what we can do. And I think one of the stumbling blocks will be the MFT program. So it's going to be a hard one, jewel in the crown, shall we say. But hopefully one day we will get a school of social work, and that will make a lot of counties around us very happy as well.
Yeah, hopefully people can see that they're mutually supportive and complementary. They don't,
Yes.
we don't
You
have to
have
have competition.
Right. You have a mix on your staff of MFTs and
Absolutely.
LCSWs, and
As you know, when I was a graduate student, so I'm an MFT, but I was in child and adolescent and family counseling.
mhm,
Back in those days, all my supervisors were LCSWs.
mhm.
And when I would have to work on, term papers, I always ended up in the Berkeley School of Social Work library. That's
Mhm.
where all the material on child development and all of that was. That's where I went.
Uh-huh.
Yeah.
I've heard that several times. Yes.
So yeah, so yes, I'm with you. Okay, thank you for that. That's good to hear and good to know. And Lisa and I are going to start coming up, working on plans and be. This is good information to have.
Okay. Thanks, Jan.
Okay. Any other questions or comments for Jan?
Yes. Good to see you, Jan. Thanks for being here as always.
Yeah, hi, Michael. Good to
Really
see you as
appreciate it.
well.
So as far as the staff vacancies, and you're talking about, how things continue to run, I think that is definitely a sign of good leadership within the organization, section managers, your position, and
Yeah.
Director Rivera as well, like being able to do more with less, because there's definitely been more to do over the last couple of years. And so thank you for that. And thank you to the section managers. And a question around that. So I know you said the numbers are staying kind of the same, and it seemed that you indicated that that was partially due to additional departures. But as far as the offers that are being made, are most of them being accepted when you submit a letter, an offer letter? Are most of them being accepted, or is there kind of a mix?
Yeah, usually, well, by the time we sign the letter, that person has been through interviews and they want to come on board and we want them to come on board. So those, we've been hiring senior client support specialists, we've been hiring therapists. We're looking to hire some peers. There's 2 peer positions over at CSU that we are looking for to fill, things like that. So, yeah.
Okay, great. And so as far as the numbers staying the same, as far as the departures, are those, I heard you mention some retirees. Are there other things that are, um, and I know this is happening system wide, but other things that are leading folks to leave the
There
division?
definitely, Michael, for instance, say, the recently losing some staff from our CSU to go work in another county that was offering lots more. That's just, I won't say which county, but one of our neighbors just offering $25 more an hour
Wow. Okay.
for nursing staff.
Yeah.
That's, in this day and age with inflation, all the things, it's like, as much as people have a loyalty or they loved working in that program or with the team, sometimes people make these decisions. So, yeah. So that's kind of an example of some of what we're dealing with.
Jan, sorry.
That seems untenable, because I mean that's more than the vast majority, that's more than all of our peer staff make, just in the $25 an hour more is more than anyone working as a peer specialist in our agency makes, just flat out. And so to try to compete with that, I don't.
It is.
And then I wonder about even the ethics of competing with that, because then that just drives up the cost of everything else, including medical care, right? And so I know there's nothing we can do about that here, just to comment in general, as far as, yes, we have to compete, and then also at a certain point, it's like, when is enough for people?
Yeah, I mean, it's a complex set of things, cost of living, wanting to attract people to come to this county, and then, being able to be competitive with salaries of our neighboring counties.
Mhm.
So that plays into it.
Yeah.
Yeah. And for instance, nursing nursing's out, nurses, it's very competitive out there in the nursing world. So, yeah. I just also remembered another update for all, is that we have started, Dave Kiff is our new Homeless Services Division Director. So in health services, homeless services has become their own division. And the director is Dave Kiff, and would be good. We'll have to invite him to meet the board.
Yeah, I think that's a fantastic choice. I know he's been intricately involved as interim director of the CDC, and so it seems like a natural fit and
Yes.
a good move. So I'm
Some
glad
of
to
you
see
may
that he's on.
have already, know him from work with the CDC and all of that. So,
Yeah. Great. Well, thank you again for being here and for your updates and all the work that you're doing.
Yeah.
I appreciate it.
Janet, if I could just add a footnote, it's not a pleasant one, but I do meet a lot of different social workers. And there was I'm wondering what you're doing with Spanish speaking or bilingual personnel that have degrees, but they're not licensed yet. And this particular person was shunted down to the Valley because the person didn't have a license yet. But it was a bilingual staff with an MSW. And as I understand it, a lot of the long-term care people from the mental health department might be in various nursing home beds or family care home beds down in the Valley. And so she was kind of isolated from everybody that could help her. And she left and went to another agency because she needed better. But don't you have another way to help staff coming on board to get their licensing hours without that kind of sending them off?
yeah, I mean, we're actually right now we are looking to hire like an LCSW supervisor. We're looking for someone who specifically would supervise all our ASWs who are trying to get their hours
Good.
supervised. So we do have on staff a couple of LCSW supervisors and managers, and they can do some of that supervision, but it's a lot. So
Oh, yes.
we do have an allocation to develop a contract with an LCSW. So we're looking to try to fill that because we have staff who need to have their hours supervised.
Yes, that's right.
Yeah, it's really
And then
important.
you need bilingual staff as well.
We do.
And they shouldn't be shunted off to the Valley to board chairs.
So that person decided to go work for an agency as like a traveling social worker so she could get her hours supervised.
I don't want to say what agency.
Okay.
But
Okay. No.
it's another legitimate
Provider.
agent.
Sure.
Yeah. So
Yes. So actually,
anyway,
yes, we're always.
got to hold them tight when you get them. It's hard to get.
I agree. Yeah, we have to do everything we can.
Yeah.
So yeah, we're working on that one.
Yeah, because I know the bilingual staff is also a critical need. Has been
Definitely.
for a long
Yes.
time.
Mhm.
Thank you.
You're welcome. Thank you.
Okay. Anything more for Jen? Okay, thank you very much, Jan, that was a very thorough report.
You're welcome.
Yeah.
I could tell you lots more, but I'll just stick with what I shared. There's plenty.
Okay. Okay, so let's see what we've got here. We still don't have the representative from Susan Gorin's district, so.
No, may I add something? It was not for the executive meeting, it's for the general meeting. Person should be coming.
Oh, okay, so she should be put on the agenda for the general meeting?
because for the general meeting, I didn't realize that until this morning that it was put on the wrong agenda.
Okay, did you get that? Down, okay. So do we have, I see the site visit committee is down kind of twice because that's what Pam is. But this is the time, I think, for you to report on what's happening there, Michael.
Yeah, so I do have the Michael Martin at the Russian River Empowerment Center said he's available on Mondays or Wednesdays after 2 p.m. And so if folks who are interested like to pick a date for that, then that would be available. The others are still, so we just had we had a peer managers retreat last Friday and strategic planning for the year. And so they're outlining their calendars, and they will all they're all going to get back to me by the end of this week with dates that the other centers and programs will be available. And so the peer education training program is on site at the Wellness Center, so there could be kind of a dual one there. And then at Interlink, our transitions to housing team or manager is focused there, so we can do kind of two there as well. And so I will have available dates for those certainly by the next executive committee, and it'll be by the end of this week is when I requested that they get those in. So
Okay, so we should wait to hear from you.
yes, and should I submit that to Susan to put out in a general email to start getting interest for discussion? Should I wait until the general meeting, the next executive committee meeting? What's the best course of action?
I think you could put an email out to get interest and maybe some possible dates so that people could start planning.
Great. All right, I will do that as soon as I have those. Thank you.
Okay. Acknowledging behavioral health staff. Last month we acknowledged East County, and we actually have two presenting this month. The Children's Services, youth and whatever its actual name is, Youth and Family.
Youth and Children, yeah, Family, Youth and Children, I think.
Family, Youth and Children, yeah, and then the psychiatrist is from the county Youth and Family Services. So
Dr. Shin?
what is her name?
I think it's Dr. Shin.
Okay,
Yeah.
because I was supposed to contact her and I was going to have to look up her name. I did not contact her and I need to. So hopefully she'll be available. So I will look, and I'm going to look back at the presentation from QIC and make sure that that's the right person. But yeah. Okay, so
Her name, I'm pretty sure it's Susie Shin Calandrea. So she has a hyphenated name. I'll double check that.
okay. Okay, so
Kathy, when you have that name and spelling, will you zip an email to the DHS MHB box for me?
yes.
Thanks.
Okay.
I just looked it up. It's it's Susie, SUSIE, and then SHIN hyphen CALANDREA. DRELLA.
Okay. So,
And I can
yes,
put that in the
thank you.
chat as well.
Michael.
Yeah.
Did you get that? Okay, good. Okay, so we should probably I mean, it would probably make sense to acknowledge one or the other of them. Does anybody have a preference for which one to go with this time? I'm thinking maybe that we would have other opportunities to acknowledge within the county system. So maybe the youth and family services. But I can go either way. There's not very many of us here to make that decision.
Yeah. Yeah, there's 5 of us. I think, I mean, I don't know Dr. Shin, or you saw the presentation, and so I'm not sure how extensive her work is within. I think, a director level of the family, youth, and children is a pretty integral role, especially with the considerable challenges that youth are facing as far as mental health at this point. So those are my thoughts.
Jan?
If I could just say here that Dr. Shin is actually kind of part of what Youth and Family Services. So by recognizing Youth and Family Services, I mean, you could also acknowledge that the child psychiatrist, the children docs, the child psychiatrists, they're part of YF. They're part of the program. I mean, Youth and Family has also the teams are definitely worth, of course, deserve recognition, and the docs are part of those teams. So, I mean, you probably could lump them together if you wanted to.
There's two separate ones though, aren't there? Are they part of the county, the county group, Family, Youth, and Children, with Donna Broadbent being at the helm of that? Is that the?
Oh, yeah, that's health services. So
health services. So we're
Human
going to have hopefully somebody from both of those.
oh, I see
So
what
we're
you're
looking
saying.
at it. Do we acknowledge health services, that group, or county, within the behavioral health system, Youth and Family Services? So that's the
decision. Okay, I'll then.
Yeah.
But I'm gonna butt out.
no, but that was good. Then I mean,
I forgot that that Donna Broadbent's coming, and yeah, they do a lot. So
and they are a little bit outside of the system. I think that we would probably have somebody else at some point from our internal youth and family that would make that a good acknowledgement. So
okay,
I'll go with the group's decision. And Michael's the only one that I'm seeing talk. So for me, it's eeny, meeny, miny, moe.
I'm here. I just don't have an opinion one way or the other.
Okay, Peterson, do you have an opinion?
No, I don't know. I don't know any of them. So whichever way anyone goes, I'll go with it.
Marianne, do you have an opinion?
I think both Children's Services Group with Human Services and Mental Health Service, Behavioral Health should be recognized. It's very tough work, and the demand for services right now is really intense, I suspect.
Okay, so I'm willing to write 2 certificates and acknowledge both of them. Then the question becomes, do we just go with youth and family services or specific to the doctor? Kind of thinking youth and family services as a bigger group,
Yeah,
and then we can narrow it down later if we want to and just acknowledge a part. Does that sound reasonable? I'll just acknowledge both of them.
I
Okay,
think that would be good. And I think any chief of staff would be so proud to have their work group acknowledged by a citizen board. I think it's a good thing.
okay. So, yeah, so maybe when you, Michael, contact Donna Broadbent, maybe you can first of all let me know for sure that she's coming, and then second, tell me exactly how what the name of the organization is. Just email it to me so I get it right on the certificate. Okay. Okay, so I've got the agenda. I'm using 2 computer screens today. I never do that, but it went black. So now I'm looking again. Okay, so chair report, I am not the chair. I don't know if Peterson has anything to say.
I don't have anything per se. No.
Okay, I'm going to acknowledge that there was a a request for public records, and was that resolved? It wasn't clear to me that it was really to us, that maybe they were asking the mental health, the MHSA steering committee. Maybe that's what they were actually trying to get to.
It was resolved. It was resolved. I know. Ken sent a big thank you this email this morning.
Yeah, it got
It's all
resolved.
good. Yeah.
Thank you,
Okay,
Susan, for your help with that. Yeah.
Yeah, because that, I mean,
It,
it's a little,
it didn't sound like something that we had to address.
but it was just confusing whether they were actually
Yes.
after records from the mental health board or from the MHSA steering committee. So I'm glad it was resolved. Thank you. Okay. So anything else that we need to address?
Yeah, I did have a question about something we discussed previously as far as we had as a part of our retreat, and then in subsequent discussions, we talked about Board of Supervisors engagement. And one of the things that we discussed was during the public comment period, just giving an update on what we're focused on, what's going on as far as the mental health board business for the month. And I started to do that, and we talked about doing an email to all of the supervisors as well as a public comment portion. And I started to do that, and then I wondered if it was something that had to be that needed to be discussed, or I don't know what the rules are as far as if that's something I can just do, or if we need complete board approval, or just the discussion, the assent that was happening there. How is it okay to proceed with that, or do we need to put that on the agenda to discuss as far as how we're going to do that and who's going to do that?
Yeah, I think that maybe we should come up with a format. Like, are we going to just tell them that this is the presenter at the meeting that we just had, and we're considering, this presenter for the following. Just, I don't know whether, it just seems like it would be good to have a format so that you didn't have to make it up if you were the one doing it, that it was pretty concrete. I mean, maybe that is something that we actually discuss put on the agenda for an executive meeting,
Okay.
just to have a format. But I think it would be very logical to just report on what we our presentation was and who presented, and that would be, it's already public knowledge.
Mhm.
And if we had an idea of what the next presentation was going to be, then that would be easy public knowledge and let people know that what we were doing.
Okay, so is that,
And-
so we want to put that on the agenda for February's executive, or I guess this
think-
is February.
Doesn't that
March.
make sense? To
I think so.
discuss it and come up with kind of a
Yeah,
form.
it does. It does.
That sounds great. Okay,
What did
good.
you, yeah. Okay. Okay. Some fleeting thought passed my mind and it's gone. So it'll just have to wait, whatever that was. Okay. Anything else? Okay, Peterson, this is your turn.
Yep.
You can ask for a motion for adjournment.
Thank you. Okay.
So go ahead. You're in charge of it.
And it's my turn. Okay. I would like a motion to adjourn the meeting. Would anybody like to move a motion to adjourn the meeting?
I also move. Anybody want to second that?
I'll second.
Yay.
Thank you. I'm not seeing anybody, so I have to wait for voicing.
Okay. So the meeting is adjourned and thank you, everybody.
Thanks, everybody. Sorry about that. I've been ready for that meeting since I was out for a month on jury duty. And then following that, I ended up with COVID and I was really happy to be back, but couldn't chair the meeting because I couldn't get into the meeting. So hopefully that will be resolved for the next time.
Yep. I think that we'll be happy to have you back. And I'm glad that your jury duty is over and you're feeling better.
Yeah, it was quite interesting, I have to say. It was rather interesting.
Yeah. Okay. Well,
Okay.
thank you, everybody, and we'll see you in a couple of weeks.
Thank you.
Thanks,
Thank you all.
everybody.
everybody.
See you
Bye.
soon.
Thank
See
you,
you.
everyone.
See you soon.
Thanks for
Take care.
coming.